Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part they are pretty good patients, because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions, and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for lay people. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I noticed signs of something more serious, I would go to someone else. Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health, that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do, so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with itty patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation. The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The radonc, for example, thinks and speaks differently than the orthosurgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured. I try to act like any other patient. Medical people can very much sabotage their own care by taking shortcuts or perhaps declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless, because I know that they are. But I do go see my regular doctor for problems that really bother me, or for routine exams like anyone else. It can be weirdly stressful to be the doctor or the patient in this kind of interaction. I've learned to not let it bother me when I'm the doctor seeing other doctors. It can be harmful to the doctor as a patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. As a nerd doctor, when I go to my PCP, all decisions are made in tandem, and I do have more input on my treatment plan than a layperson. But I second what others have said. When I'm seeing another physician like a specialist, I'm more capable at making informed decisions than a layperson, but will always defer to their experience and knowledge. 2 examples had a PCP that said jokingly to a medical student in front of me, "How the hell could he even sue me? He's a doctor." Promptly found a new PCP. It's okay to not like a doctor. Even doctors dislike other doctors. I'm a doctor with literally tens of thousands of hours of experience and knowledge saving people's lives, and even I know that I don't know 0.1% of what 4C knows. Wear your goddamn mask, it's not a debate doctors are having, just morons. Had a relative who was an old-fashioned veterinarian and probably the worst patient because of it. This guy would argue with his doctors about his prescriptions and then order the meds through the vet pharmacy cause they were significantly cheaper. Which makes sense, I guess. Why pay $50 for a particular med when he can source the exact same thing for $5? But still, it looked kinda funny when he was in his 80s hobbling around with heart meds that had "for dogs only" in big print on the bottle. Edit. Clarify vet equals veterinarian. Doctor here. Like someone else said, if I'm seeing a specialist of a particular field, then I'm unlikely to have anywhere near as much knowledge as them, so I would consult with them just like any other patient. If it's something more general, and I'm seeing a GP, for example, I will tell them I'm a doctor, so that they don't go into lengthy layman's explanations, but generally will try to have a normal doctor-patient relationship. I might throw in an opinion on what I think, but ultimately I try to shut up and respect that they are a professional and not tell them how to do their job. It's hard to be objective too when the patient is yourself or a family member. Having someone give their unbiased opinion is often more useful than self-diagnosing, or at least might add some more knowledge or insight that you may not have yourself. Greatest doctor call of all time. First, paramedic here, not doctor. Call for chest pain. Side of the road. Guy pulled over to call 911. Not local, just passing through. While my basic is slapping. Leads on, I'm getting some history. Guy is obviously well educated, knows his stuff, and just speaks the lingo. I run a 12 lead. It's bad. Not end of days. Just hey, let's get the cath lab wound up and drive really fast. It's also a little odd. So I decide to flip it. 15 lead. Flip it again, do a right side whole time we are making tracks to the Guy asks about nitro, and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him, hand them over while I'm calling in my report. He thanks me, say I'm right, it's anterior etc. and has going to needs his bypass etc. Freaking cardiologist. Coolest, most laid back part ever, having a freaking heart attack, and starts explaining to me about the surgical process he's about to be under. Not a doctor, but I'm finishing my MD degree this year, yay. Just wanted to say that you don't have to be a healthcare worker or a physician for your healthcare to be seen as a group project between you and your physician. Medicine is inherently collaborative, and if you ever have questions about what or why treatment is being given, or what or how you were diagnosed, you should always ask. And if they refuse to give you reasonable answers outside of BC, I said, so then you should be asking for second opinions on your project. Just BC there's someone spearheading the endeavor doesn't mean you should let yourself be apathetic to your care. That's a dangerous level of trust for anyone. You wouldn't trust one controller on your collab projects in high school, and things always go better when everyone puts in their part. Close bracket. A dentist here. Well, considering just inside my field, yeah, I have to see another dentist for checkups and work done if that's necessary. No other choice for us really. I haven't needed any big work on my own teeth, but if so, I'd surely talk it through like a project with my dentist and consider my different options. pros and cons. However, the thought that another person is drilling in my teeth makes me feel paranoid. You never really know how skilled they are with their hands until the job is done, and I just have to trust my choice in dentist. Much respect and love for my patients who trust me with their health. What an honor it really is. Manuscript 3 medical student and my dad is a Palm/IQ document. Growing up I only ever went to the pediatrician until age 11 to get the standard peds vaccines. Otherwise, I've never went to see a different doctor. If I ever got sick, my dad would just diagnose it, write a script, and have mom pick it up. Physical exams for sports, university etc. were just signed off at home as normal. My dad has been practicing for 25 years, and he has never actually scheduled a doctor's appointment. If he ever had an issue, then he would just write a script for himself. If it was something that he couldn't do himself, i.e. drain a pill on idle cyst on his chic, lol true story, he would just have his surgeon buddy come to the house and do a R&D in the living room for a bottle of whiskey as barter. He's definitely his own doctor. Dentist here. Having a cavity that someone else has to fix is one of my greatest fears and the reason I brush and floss every day. If it was physically possible for me to competently drill and fill my own teeth I would. There are hundreds of different ways to fix a tooth, many of which are barely clinically acceptable. Then on top of that is the experience of the dentist, which can range from someone's first day out of dental school to a seasoned clinician. Even seasoned dentists can worrisome if they are mind-locked in doing dentistry in outdated ways. I have known so many dental colleagues that have just the best personalities, good chairside manners, but would never trust them to put a drill to my tooth after seeing some of their typical ways of fixing teeth. And no, you cannot simply have another dentist to do it your way. You're better off looking for a reputable dentist known in academia for doing dentistry the way you believe it to be right. This may involve travel and paying full fees for the work. Forget about dental insurance. I'm a surgeon. I don't even tell them. I had a procedure the other day and I didn't feel at all like a person who could perform the procedure on myself, while awake probably. I just let them do their thing. My wife actually tries to get me to pull my doctor card to get quicker appointments or better attention, but I just won't do it. So I have to fucking call back like 3 times to get a response, stay on hold 45 minutes, etc. like everyone else. By the way, this was the first time I've ever had a procedure because I had to. Besides that, never been to a doctor, hospital, or anything, except for a kidney stone once. I think I went 15 years without seeing a doctor after I had to for my entrance physical for residency. My wife is a doctor, and it varies. Sometimes she doesn't tell, cause she doesn't want the other doctor to assume she knows stuff and them to explain stuff to her in a very simple way. Sometimes she does tell, especially if it happens that the other doctor works in the same hospital or in the same field and they chat a bit. TBH, it doesn't really matter because the modern medicine is so specialized. For example, if you're an otolaryngologist and taking your kid to see a pediatric orthopedic specialist, the knowledge gap in the clinical experience between you and that field will be so massive that you might as well be a layman. I'm a pediatrician in Mexico. My dad is a general practitioner, but has a small clinic where his surgeon friend comes and does ambulatory surgeries. Year and a half ago I told my dad I think I have a hernia, and he was like, looks like it. Next morning I was having hernia surgery. I only had a mild sedation and an epidural. I think I got ketamine. All I remember is that I wanted to see what was going on and kept trying to sit up. They had to give me more, so I finally fell asleep. Also, I have ADHD and I sign my own prescriptions. I'm a heart doctor. My partner is also a physician. We try to not diagnose ourselves with anything, and we don't send in prescriptions for each other. When I see a doctor, I don't bring up being a doctor unless they ask me what I do for a living. Part of the standard social history. If it comes up, it doesn't take up much of the convo. I've also taken care of many physicians in the hospital. Many have been great patients. Once in a while you'll have a cantankerous retired physician practicing medicine from the 1970s try and dictate their care plan. That said, I've had many patients not in medicine try to tell me what I should/should not be doing. not a doctor, but I work for a medical advice phone line. I'm not medically trained. I once had a doctor call about her husband who was also a doctor. He was unwell, and I had organized for another doctor to call them in the next hour. We always advise that once we are off the phone, if anything changes, to call us back. The wife argued this and said, well, what happens if he gets much worse? I had to explain to a doctor that once the phone gets put down, I don't know what's going on. I can't organize anything if I don't know there are changes. She got annoyed that the responsibility was put onto her. I'm a physician assistant. Obviously, not the same. Despite being relatively young and still, thankfully, healthy, my primary physician and I have a good dialogue, and there's a lot more shared decision making. He seems to enjoy being able to speak in medical terms with me. To that point, I feel the same when I've taken care of physicians, other mid-levels, or nurses in the ER. Also, that's not to say, when we treat lay people, that we don't use shared decision making. The process is just smoother and easier when having the discussion with one of your own, so to speak. I was in a severe auto accident and had to be rushed to the trauma center in AS. I was living with my parents in Indiana at the time. Mom is a dermatologist and dad is a surgeon. They got the call from the trauma surgeon after I signed all of the release forms and were able to discuss my conditions and what operations the trauma surgeon was thinking about doing. I had a severe injury to my left buttocks and it needed to be cleaned out and reattached to my sacrum. Trauma doc asked my dad if there were any issues he saw in the surgery, as my dad exposes the back and legs for a living. Exposes meaning moving the arteries and veins away from the bone for either the orthopedic or spine surgeons to operate. Quite a cool experience seeing that happen, and felt proud to be my parents' son. Recovery sucked though. Yesterday I went for a consult, free of charge. Let's start with this, which was quick to schedule. Can I stop by today? Anytime. Thanks. I stated on the phone what was the problem. When I arrived, he wasn't with any patients, so I came right in. I immediately confessed to him that I tried to solve it by myself first, and came only when I felt that maybe I should ask for a consultation by someone expert on the field. Funny thing, I spontaneously started to present to him my case like I usually present patients. I'm 30 healthy, no allergies. I came to you because I have AIDS, started 2 weeks ago with accompanying symptoms B and C. I self-medicated with D&D, etc. He examined me. This part is mostly the same as everybody. Turns out, I was right on the diagnose and was mostly doing the right thing. He gave me another, more effective, prescription, and I went on my way. I guess the process was also pretty fast from start to finish, maybe because communication was very fluid. Doctor here, orthosurgeon. Like many doctors here, I'm also terrible at going to the doctor. 1. Because I'm busy AF, and 2. I'm early in my career, and I'm in solid health. I can echo a lot of what's said in this thread though. I just STFU and let people who deal with chronic medical issues do their thing and show them the respect I'd want if they were coming to me for an orthopedic issue. Even when I busted my knee and saw another orthopedic surgeon, I followed their recommendations to a T. Sometimes your own bias can cloud what's best for your health. It's good to take a step back and get a different perspective on an issue rather than only trusting your own opinion. This bodes well in practice and life in general. In my case, I mostly tend to stay quiet unless it's something very obviously missed or someone heading down a path that I wouldn't agree with. I'm a GP, family doctor, and when I go to see my doctor, I tend to let him make decisions about which blood pressure tablet or statin or what investigations to do for my hypertension/cholesterol. I don't often disagree too much. These things are as much of an art as a science. However, when it was in relation to one of my children, and it was very obvious that the GP was going to underplay symptoms and not investigate, then we have a good discussion. I'm a veterinarian, and I've had to go to my doctor with a possible diagnosis as well as the necessary tests that she needed to run for quite a few obscure diseases. I've been exposed to a lot of zoonotic diseases in my line of work which doctors don't always know a lot about, which is fine. since in my country zoonotic diseases is about 1 week in their entire undergrad program, and the whole idea of One Health is that MDs should consult veterinarians when dealing with zoonoses. It's nice to be able to understand and use most of the jargon. I've often found that doctors are more honest with me when I speak their language.